Now recognize Ms. Lesko from Arizona for 5 minutes of questions.
Thank you, Mr. Chair. Before I ask questions, I want to say thank you to the Chairman Winstrup. Both he and I are ending our careers in Congress, and so I really appreciate all the work that you've done. I think this has been a very important committee, and thank you for inviting me on it. I also want to thank the other members, including the ranking member, Dr. Ruiz. It's been an honor serving with all of you. Now I'm going to get to my question. Dr. Tabak, I want to follow up on what Chairman Comer asked about and Dr. Morens. It does appear to me from previous testimony and questions that our staff that he violated rules, whether that's FOIAs, he was trying to get around FOIAs. It appears that he was trying to help Eco Health Alliance, I should say, and why can't you fire him? I don't understand why it hasn't happened already.
They're following our process.
What is the process? How long does it take to fire somebody?
We follow our process.
What is the process?
The individual is accorded the opportunity to present their side of the facts. Right. An individual is then charged with making a decision as to what should occur. Again, this is hypothetical, of course, in terms of, I can't discuss any specific case. Mm-hmm. Once that decision is provided to the individual staff member, he or she is allowed to appeal that decision, and then that goes to a second official for a final adjudication. So we follow our process, and that's what we're doing. Has this process been started? I'm not allowed to discuss any specifics of the process. Well, I hope you understand, sir, why, myself and the American public just don't, they think this is not a good policy because, for instance, in a regular company or business, if somebody violated the rules, you just get fired, right? And so that's why I think some of the actions that are being taken with the next administration are probably happening, because the American public just don't understand why somebody who seems to have clearly violated things, the answer is just we're following the process. But my next question is actually for all of you in the little over 2 minutes I have. The Americans have decreased less trust in the federal health agencies after COVID. And I want to know from each of you if you or your agencies believe that you played a role in that, and if so, how are you going to change it? Well, since I have my mic on, I'll start. Of course, this was a very fluid situation, as you, of course, appreciate from your work on this committee. And we understand that we have to do a much, much better job of being more transparent, of doing better communication, of getting into communities, working with trusted partners in communities. You just can't so-called parachute in and expect people to benefit from your wisdom. You have to have a real conversation with them in a transparent manner.
I would agree with Dr. Tabak. Trust is critical for a public health agency. There was a number of the pandemic was moving quickly. The virus was changing rapidly. We were putting out a lot of guidance almost weekly, and it became very difficult even to find the information that was needed on our cdc.gov website. We have made changes. We've tried to be a lot more transparent. We've streamlined actually our website by about 60%. We've tried to move to make it more plain language so it's more accessible to the American public. So we acknowledge that there are challenges here, and we are responding to them.
Yes, I would agree as well. I think one of the things that we've been working on is how to work in concert with individuals who are in other settings, clinical settings. the individuals right before us right now, people who also have the ear of the American people, and trying to make sure that we're putting out information that is both high quality, up to our scientific standards, and digestible.
Well, thank you all for your answers. I would say that it is important to be more transparent, and that goes back to my question about Dr. Morens. I mean, just saying procedures. Now, maybe there's legal consequences, but that's like not a very transparent answer in my view. Also, I want to suggest to all of you, hopefully you've heard it before from me, is that government mandates, that backfired. I mean, I don't think there should be government mandates at all. I don't think they should be suggested because people don't trust the government. And so that made people less trustful of the government in my view. And so with that, I yield back.